Hi, my name is Justin,
And I'm Tiffany.
and we are from Dental Design Clinic. Welcome to our first ever podcast that we're doing, and this is in line with a couple of podcast series that we're trying to do to educate people about what's the in and out of dentistry. Okay, so today's topic would be to talk more about what are you talking about? We're talking about smile aesthetics in dentistry. So we're going to talk more about smile aesthetics in dentistry, and it's a very, 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 very general topic, and we have so many things to talk about. And one thing that we have in our clinic is it's a photo studio, right?
Yeah, it's a photo studio, and patients always ask us about why we have a photo studio in a dental clinic, right?
Yeah, I mean, like that's the thing that we always get asked. Why do you have a photo studio in the clinic? Like it doesn't make sense. Like usually clinic doesn't really have a photo studio.
Yeah, when you think of a dental clinic, it's like, the chair there, then the scary dentist, that kind of thing.
Yeah. So I mean, why do we have the dental clinic? Why do you have a photo studio area?
Yeah, so we have a photo studio because the studio allows us to take photos of the patients in various positions so that we can check the facial features from all the angles. Because for us, for me, and I think you
So you do mostly primarily like Invisalign and teeth straightening like braces, and so that would mean that you're using the photo studios to actually shots on the photo studios to actually go and analyze some data. What do you
Yes.
usually analyze for?
Yes.
Right,
So when we are straightening the teeth, actually the primary objective of the patient is not just a nice smile, right?
Yeah.
It's also that they look nicer as a whole.
Yeah.
And sometimes when you have straight teeth, you may not necessarily look so, wow. So to have that wow factor
The booms, is it? Yeah.
in the smile,
Yeah.
I believe that the smile must be harmonizing with the rest of the facial features. For example, if a person is very petite, then maybe if it's very protrusive or very out there, the smile, it may not fit them so well. So we have to assess this, and we use the photo studio to help us take photos from various angles, and then that's how we can check.
Okay, so what's the one key sort of facial reference point that you usually use to help to align your teeth?
Okay.
Just so I'm curious about that.
Yeah, so I would say that, a common sort of perception is that the smile, when you think about whether the smile looks good or not, is from the front. So if you look
Yeah.
at the smile from the front, usually people look at that when they look in the mirror, right? But another thing that really makes a big impact on the beauty is from the side, like how people look at you. Like for example, now when I'm looking at you, it's not a 180 degrees to your front.
It's like
It
a
is
bit to the-
slightly to
okay.
the left and right. So that sort of aesthetics can also affect like how the teeth look in that. And a very common sort of landmark we use is from the nose to the chin, where the position of the lips
it's like
is in relation to that. Yes.
Okay, so
Yeah.
like that. Okay, all right.
Yeah.
Oh, that's called what's that line called again? That's the E line, right? Is it?
That's called the E line in facial aesthetics.
okay.
Yeah.
Cool. That's
Yeah.
cool.
And I'm sure, Dr. Justin, you also use that line as well in your
Yes,
treatment
I do.
planning.
So that's a very important line because that, especially with Asian ladies, they tend to be a bit more. The upper jaws tend to be more protrusive, more forward compared to the lower jaw. Therefore, it's very important that if we're doing veneers or anything cosmetic, we don't want to add more volume to that already if we are nearing the boundary towards that E line, right? Because that would mean that patients always complain to me, hey, they came from another dentist and say, hey, I did veneers or whatsoever, and they look too bulky. I look like a horse, all right? I look like a rabbit because I'm pushing out the teeth too much that I can't really close my lips anymore. That's one thing. The second thing is that if you have a look at, this is called the philtrum, the two lines here. If you bulk it up too much, it will lose that philtrum and it just looks not natural. It looks a bit like a monkey or a horse. And
Yeah,
that's not what we're
unfortunately.
that's not what we're trying to do. We want to try to have the smile fit the face. And as a very, very, very famous dentist who have said, if you treat the face, you change people's lives, right? And so, so that will help with actually If you try to harmonize the teeth with the face, then you really create something special, not just some stock standard. And this is what you're trying to look for. You're trying to look for a bit a natural look that is fitting towards the face. I think that's very important. I think
Yes.
because I mean, I'm sure you had
Yes.
a bunch of patients who have done Invisalign or braces before, and the teeth look straight, but they just don't look right.
Yes.
Right? Yeah.
Because like what you were saying, when we look at how the teeth fits, I think a very sort of how we were taught or how most dentists are taught, we just look at the teeth. And sometimes the teeth, when you look at it on the model, it can look very nice, very aligned. But when you look at it in relation to the face, which is what we want, right? When we want a nicer look appearance overall, when you look at that, then it may feel like, oh, something is not quite right. And I do get a lot of patients coming to me for like a second opinion or retreatment because they feel like my teeth is straight, but I just don't like some things about it. And then sometimes they can't pinpoint exactly what. And then, so that's why it's great for us to have that discussion. And then sometimes it's things that we could change. And I think we have also had some patients in common in the past whereby I think they went to you first to check about veneers as an option. And then, after we did like a treatment planning, and we realized they're too, like their, as you said, the E line is not in line with the ideal or I would say the beauty norm, then it was a joint treatment planning where we had to do some kind of orthodontics first to bring back the smile curve, and then we could do some sort of further aesthetic enhancement.
That's one thing that I always see is the teeth look straight, but it's like this. Right?
That's also
and then
possible.
it's straight, but it's like this. It's canted, what we call canted, right? And to fix that is a lot more work. It's not just, you can't just do veneers. If you want to do veneers, you can, but you're going to trim a lot of healthy tooth away, and that's not what we want. We want to try to trim as little as possible or without any trimmings to try to beautify the smile. And how would you do that if it's tilted like that? How would you do it? How long does it usually take?
So you have brought up something that is actually very difficult to spot. I think a lot of people don't realize that until after a while, because the teeth, as you said, their teeth look straight, but when you look at it and you realize something is off, maybe it's slightly slanted, maybe it's higher on one side, lower on the other side. And then subconsciously also, some people will compensate by tilting their head when they smile.
So it's like the selfie, like one of those selfie pose
the selfie pose,
Right.
They could tilt a bit, and then that makes the smile look more level in the photo. And then they don't realize they're doing it until we take the studio photos in the studio, and then we can discuss about that. And then usually when they realize it's like a light bulb moment, they're like, oh, my smile is crooked.
Yeah.
And back to your question about how we can treat it, it is not a very simple treatment because it does involve the bone and underlying structures and things like that. But there are quite a few ways we can treat it. And depending on how how long the patient wants treatment to be for and things like that, we can work something out with Invisalign alone, orthodontics, or together with some sort of auxiliary appliances that we can use together with Invisalign to help push the teeth a certain way. Or we could also do some kind of Invisalign together with some kind of restorative treatment. So we push it up, and maybe if the patient is time conscious, they don't want to spend too much time on it, then we could also sort of augment it with some kind of veneers or bonding, that kind of stuff. And often what I see, and I don't know if you have seen that as well, is when the smile is slanted, the bite or how the bottom teeth touch the top teeth can also be affected. And
because everything is just slanted, right?
Yes.
So one side will be higher and the other side will be lower. But the upper teeth will be just in opposite.
So that it has to match like that, right?
Yeah, you're right.
So, and then what happens often is that it also wears down unevenly. So then one side could be even, that slantedness could be even more accentuated because it's wearing down on the longer side and things like that. So then that's when after orthodontics, sometimes the teeth still look a little bit off because it's worn out. Sometimes it's one long and one short. And then that's when we have to think about...
It's going to be problematic when you align them together, right? Because once you move everything there, one side will be like flat, or one side will be taller than the other one.
Yes.
Then how then I guess I'll be the one going in to add more volume to
Yes.
worn down area.
Yes,
to build it
because
back up.
if
Yeah.
it's long and short, then we want to lengthen that short one to make it match in a symmetrical way, right? Then so that's when, you know, it's not just something that Invisalign can treat, it has to be
Like a
some kind of...
multidisciplinary approach
Yes,
kind of sort of thing.
yes.
Yeah, you're right. It's quite interesting because when we are actually, you know, when I treat someone and I improve their smile, and habitually these people have been smiling like that for the longest time with a bad smile or a crooked smile, all right. And when we finally fix their smiles, it takes time for the body, the mind to actually reset. And when they smile, they look more confident. But at the same time, also they tilt their head differently, because the way
Yes.
they compensate is different now, right?
Yes.
And so that's very interesting. It's like the body trying to relearn a new way to smile.
Yes.
All right.
Yes.
And sometimes what I tend to see is that also if the smile is not so nice, they tend to smile really small, really little.
Yes. Yes.
But once you really improve the smile, then suddenly it show a really wide smile, show a lot of gum, things like that, and be like, "Ooh, I didn't see you like that before."
Yeah.
And so that's quite an interesting thing, and that's how it's interesting how the human adapts to that
Yeah,
as well.
I think it's also nice for the patient to see, because often I think for my treatment it normally takes a little bit longer, like a few months to a year, years, you know. So sometimes during the process, then I can see them changing, like their mannerisms and things like that. But sometimes the patients don't really realize until the end, because we also give them the before and after to have a look at how their progress is, and you know, their achievements in how they have really put the hard work in to improve their smile. And it's always nice. They're always very, you know, pleasantly sort of surprised, and they're always like, oh, you know.
Yeah.
And for us, I think it's also very satisfying to see that confidence grow in them, because as you said at the beginning, they could come in and when you ask them to smile, they do this, you know,
Yeah.
because they just don't want to show it, and they are very concerned or anxious about their smile. And it's such a sort of empowering thing for us that we are able to treatment plan together with them and provide something, then work together with them to get something that, as you said, as they have that confidence, they really portray
you're right.
themselves
Absolutely
differently.
right. And now so maybe you know, I think that if we actually but at the same time also we need to understand, when you treat all these patients, I think it's important to understand the needs of the patients, and I feel that in the current day and age, the industry is trying to make people do veneers when they actually don't really need veneers, right? Or do like composite veneers, which is basically putting some filling material on top of the teeth. And even though we do quite a bit of these things, I do quite a bit of this kind of stuff, but I think it can be a lot more conservative to try to improve the smile. So I think like maybe moving the teeth would be a good idea, right?
Yes.
So yeah.
Yeah, so I think it's quite nice actually, Dr. Justin, that sometimes the patients come to you and they might say, I want veneers. And then you look at you look at the whole case, and then you discuss with them, and then finally maybe they realize, oh, and you give them different options, right?
Yeah.
That's really great, because like
So I think the
different
it's
treatment
important for us
options,
to give them
yeah.
all the options so that
the patients can make the right
and
decision
we reduce the
for
biasness of
themselves.
everything, and so that they can choose what's best for them. I think that's really important for us. Yeah.
So that's I feel that's very great, that when you see the patient for veneers, and you know, you could easily just do the veneers, but then sometimes you send them to me because maybe, hey, Invisalign could also do something for you, and then we don't have to grind the teeth down, you know, then that's also a nice option, I think, for the patient.
Yeah, I mean, I'm seeing nowadays, because of Instagram, social media, things like that, you get really young people coming to look for veneers, all right? Or they have already gone to a beauty salon or another dentist to get veneers done, all right? And often I have to change veneers, or I have to tell them, hey, look, you don't really need to do veneers in the first place, right?
Yeah.
Because it's too young.
Yeah.
And maybe we can just get away with a bit of teeth straightening and some whitening before we actually do sit down and really trim some teeth away, right? And that's really important to understand that.
Yeah, you're right. I think the perception of self nowadays, maybe because there's so much social media, sort of there's a bit of comparison going on, and people want to look as good as how they think other people look. And there's also, like apps or AI that can make your smile look better on photos. So then when
It's like a
people see that,
self-comparison sort of thing,
yeah,
right?
they are actually comparing maybe against something that's not really real, But then as humans, we will tend to want to be better when we see that comparison. So I think there is this sort of growing trend where people try to improve themselves in real life, and then they go to beauticians, like you said, to do like veneers, bonding. But it's often not done very well because beauticians, they are not dentally trained.
So you've gone to the beautician's point of view. So number one, beauticians are not supposed to do
dental procedures.
dental procedures. I think that's fair.
No, it's outside their scope of practice.
I do see quite a bit of them
MOH,
coming in. I mean, not beauticians itself, but patients. I've seen a beautician, and the common factor is that they don't fit well. They don't fit well. They're not placed. They're not done well. The fillings, the area is always leaking with something. There's bugs behind it, and it's often a matter of too much. It looks nice, but at the cost of biology. Am I right to say that?
Yeah, I think the problem with beauticians doing the veneers is that they are not trained to do so. So they do not.
And also,
we do a 5-year.
We do have a 5-year degree, but I think that also at the same time, they are just doing it at their like a place where it's just not meant to do these procedures.
Yeah,
right?
And also a danger, I would say, is that they don't realize they are doing actual harm, because it's I think a lot of people might think of it as something temporary.
You just paste it on, right?
Yes, and then you could remove it anyway.
That's what I get also. Yeah, so I get really, really, really young people, and they pay good money for it, and they paste it on and say, hey, I can just go to the dentist and remove it. The problem is that you can't really remove it and without damaging something, right? So even if I'm going to drill the teeth, drill the filling off, drill the veneer off, it takes a lot of time because I will do it under microscope to really look at the in fluorescent lighting to identify where these veneers
because it's the
are.
same color as the teeth.
So hard. So it takes me a couple of hours just to remove them very nicely. But even if you take under high magnification of like 10 times magnification, I'm still going to damage the tooth a bit because you never know when to stop until you see the tooth.
Yeah,
right.
It's a bit like if you have a clean thing or a new thing, and then you put some super glue, and then you try to remove it. No matter how high you remove, there will be some kind of
mark there. It's not like one of those cool 3M ones that you can just peel it off.
Yeah,
but still, it's still going to damage the surface.
Yeah.
You might damage the paint away.
Exactly.
And so, unfortunately, it's not a reversible thing. Now, once you remove the veneers, which I often do, what happens is that maybe the threshold is like, hey, the damage is not that bad.
I think the other problem with the damage, it is the damage that you have on the tooth. The other problem is also when it's there, and like you said, it's often not placed well, like without a seam and things like that. Usually there's some kind of leaks, there's bacteria being trapped in there and things that you cannot brush away or floss away. Then it's trapped near to the gum, and then the gum suffers because the gum can respond to that bacteria being trapped there, and they often start to be inflamed, right?
Yep.
So they get affected by it, and these changes can be permanent and irreversible. Yeah,
that's really right.
So we see gum recession, we see these issues. Sometimes when we take it off, everything's bleeding because it has been, suffocating. The gum has been
and because
damaged.
there is damage to the tooth structure already, it often looks a bit yellower as well than before they actually did the composite, the veneers.
Yeah, so I think it's really important that before doing this, I think that people are aware that it can actually cause some problems for them. Before they do it, then they should have that information. Because what I hear is, like you said, they thought, it can be put on, it can be taken off anytime, anyway it's temporary, what's the harm? But there is a lot of harm. So it's I think it's important to have more education or more awareness about this issue.
Yeah, I mean, this is a big topic now. I think we and I think that it's getting a lot more popular nowadays as well, because it's compared to a dentist, it's a cheap alternative, and it's a very pain-free alternative as well, because it's just slather it on, and it's marketed in such a way that it's reversible. It's like nails. So you can just put it on and you can remove it after that, but it's not.
Yeah. And the thing with nails is that nails can grow, right?
The nails can grow back. But the teeth can't grow
heal
back,
and
man.
recover.
They're not baby teeth anymore. You only have baby teeth once, right?
Yeah. So these are the set that you are with for the rest of your life, pretty much.
Precisely. And I think people don't understand that until they lose the teeth or they lose the structure of the teeth, and then you're like, oh man, so now we're gonna think about implants and all that stuff. That's a big topic for another day.
I think for now, I think it's great if we try to. I think it's the most important thing is that the patient or the consumer is most aware of what they are choosing for themselves, and then they can make that choice instead of it being a false choice where they think it's actually okay when they haven't got all the information.
I think it's important. Yeah, you're right. So that's why whenever I see a patient at the start, I would make sure that I take all the photos, okay, pictures of the teeth, side views, front and back, things like that, to make sure that we actually talk to the patient about the oral health in general first before we actually look at aesthetic treatment. And even if we're going to do aesthetic treatment, we want to make sure that we resolve all the primary concerns first, like decay, gum disease, all that stuff that is the foundations of building something natural. And I don't know whether you agree with me that if you build, if things are healthy, they look sort of pretty already. They look
it's a natural sort of beauty. You don't want it to look like artificial or like very manufactured. You want it to be a healthy, happy, beautiful, natural.
Yeah, and you're right. And the thing is that you can't have like sore gums and expect a nice teeth, like nice healthy set of smile.
Yeah.
Because it just doesn't match.
I think this is something that everyone can see, because sometimes like when you take photos, it's a bit like your skin, right? If your skin is healthy, then there is this sort of natural glow and things like that. And then if your skin is not healthy, sometimes people put makeup on and then it looks better, but you can see that is a difference. So I think the shift nowadays is also towards a more natural kind of beauty, which I think is great, because then there's less sort of things being done to the teeth. There's sort of focus towards the health of things. So I think that's really important.
In fact, when you look at veneers, the color of the veneers that people are choosing right now, it's not. It used to be back in the day. It used to be super white. It used to be like, I would say
I want the whitest ever.
It's
right?
so white that like you can see from a mouth, and things are getting. The trend is now getting towards like a healthy white. Like it looks natural, but at the same time, it doesn't look fake. All right. If I put a set of veneers, I personally don't want my veneers to look like they are
veneers.
They are veneers. All right. I wanted to make sure that they look like natural teeth, and people who look at my patients and say, hey, I don't see anything wrong with your teeth. They look great and they look natural.
Yes.
And they don't even notice that those are veneers.
Yes.
I think that's actually, to me, sometimes when my patients say that, that's like
ultimate goal, right?
Ultimate goal. That's the good one. That's the good one. If I do veneers and patients say, hey, people are noticing my veneers, then I'm like, I don't really like that, because that means it's either too fake or too white, right? Because
maybe they had a very big change from
they had a very but
and it's still natural.
Historically, someone have knew that them before and knew the change. Then it's like understandable.
So it's like good hair, right?
But if I knew you like from the get go and from the start, and I knew that you have very fake teeth already, then that's not great already. There's no
You don't want it to be obvious. You want it to be like. You don't want it to be
obvious at all.
They say something about lips, right? They say something like when you choose a lipstick, you have to choose my lips but better. So this is like my teeth but better.
Precisely. You cannot have like a totally different set of teeth that
don't suit you. So I think it goes back to facial aesthetics.
So that's why I don't know why dental clinics don't really have a photo studio area, or they don't take photos when you're designing a smile, because
it is so important. I think it's essential.
It's essential because how are you going to match your teeth if your teeth is going to be slanted or long or short? But it needs to match the face, right? And so it's so important.
And I feel like you can't really get this information when, in the dental chair, you're lying down. You can't really get this information so well because in the chair, I mean, I think a lot of people are
speaking to you like that,
nervous.
right?
Yeah.
We are not speaking like flat and then I'm looking at you flat, right? I'm speaking to you.
It's a different perspective,
yeah,
right?
it's a different perspective. So we need to look at, when I design a smile, I want to look at, when you design a smile as well, I think you also look at the natural head position where the patient is.
Yes, because some people like tilt a bit more
right?
down. Some people, they're taller. Maybe they tilt a
And
different
you're not
way.
looking at, hey, I'm not designing your smile when you're lying down because when are you gonna smile when you're lying down, right?
Well, I mean,
it's not that common.
yeah, but in a social setting, daily life, I think most of us spend our lives then sitting up.
Okay,
upright.
that's interesting. Yeah, very interesting.
Yeah. So that's facial aesthetics again. Yeah. Actually, what I thought of is something quite interesting because many people think that teeth shape and size is like, when they think of straight teeth, they just think of like blocks of white teeth, right? But actually, there are so many different sort of variations in the shape and size and things like that can affect the smile.
So in our clinic, we have a database of like a set of very nice set of teeth, but this library is taken from people, natural, like real people, and their teeth. We use the data from scan, like
a digital scan, right?
Scans.
Yeah.
We extrapolate those data and we can use the data. And so when we create the smiles, we're not creating just tic tacs, like blobs, just flat surfaces. We're creating new, nice textures of the teeth, the nice shapes of the teeth, nice flow of the teeth as well. And so that creates the naturalism that you're trying to look for, right?
Yeah. So I think that helps a lot in that, just now you mentioned about the previous sort of old-timer perception of veneers, like it all looks very fake, very white, very, like blocks.
Right?
Yeah. So I think if the shape is more natural, because it's from a natural library of teeth, then that helps a lot to make it natural and blend in with the rest of the face.
And to be honest with you, I think I've seen some Invisalign, some patients with just built with very small looking teeth. Just very, very small looking teeth, but they're huge. They're big but small looking teeth. How can we help with that? Like usually for Invisalign, what would you do?
Yeah, so that is also part of my discussion with patients. So we will talk about like the size of the teeth. Is it something that they are concerned about? Because sometimes we will find patients, they will say, I don't like my teeth, it's too big or it's too small. And sometimes it may not be all the teeth, it could be some of the teeth. And then they feel it doesn't really fit their personality. So in terms of the position, Invisalign can help. We can shift things around. Sometimes we can make teeth look slightly smaller by shifting them in and things like that. But if it needs to be larger, then that's something that Invisalign can't really achieve for the teeth. They can't really change the shape
because you can't really close the spaces, right?
Because
once you close the spaces, they just start stuck with just small teeth. Or the arch.
I think you mean that when people have small teeth, sometimes there is a sort of presentation where people come with spaces between the teeth, like the jaw is wide, but the teeth are small, so there's spaces in between. Yeah. So in these cases, then if they are concerned about how the teeth looks, and also another consideration is the position of the tongue, whether there is enough space for the tongue. But that's another topic.
Okay,
that's like airway and tongue position. But we take all that into consideration. And sometimes it could be, we call it a Bolton's discrepancy. That means the top teeth actually need to overlap the bottom teeth. And the top teeth need to be wide enough so that they can overlap the bottom teeth. So if some of the top teeth are too small, what could possibly be planned together with Invisalign is that if the patient wants to have a wider smile or larger smile, then we could plan to have some sort of restorative treatment with veneers after the Invisalign.
Or some fillings.
Fillings to sort of bond it and make it a bit larger.
That needs a very good team effort, I feel.
It needs a lot of communication because then we know what is the final outcome going to be before we start doing it.
Because you're going to move that tooth in that perfect position, the great position that you don't need to camouflage or you don't need to cut back too much material, things like that to create the nice smile.
Yes, because I think it's a bit like architecture, right? You have the foundation, which is like moving it, and then you have like the furnishings and things that make it look nicer. Yeah.
So you need to like build the pillars, then you can build the house on top of, I mean,
Yes.
the structure on top of that.
Yes,
right?
yes, yes.
So that's the important bit. I think that many. I feel
think
that there's quite a number.
it's
that
quite
people
hard
just
to
close the
achieve that,
spaces.
yeah,
and then
yeah.
it just looks weird because they have very small teeth, and then
Yeah.
like this masculine guy with small teeth. It doesn't
Yeah.
match.
Yeah. And also sometimes like
Oh, sorry, a small lady with like huge teeth. That also.
Yeah, but if they are concerned about it, then we can
We
talk
talk
about it.
about it,
Yeah,
yeah.
yeah.
That's-
I mean,
you're
we
right,
always
yeah.
talk about it to make sure they're comfortable with their smile. But I would say that, yeah, sometimes they could have, like we were saying before, they could have these braces or orthodontics done before, Invisalign done before, and then they say, my teeth are straight, but it just doesn't look so right. And this could be a factor, like the size of the teeth in
Yeah.
proportion to the face and things like that.
Sometimes
And-
it's very hard for patients to pinpoint because, to be honest, when they look,
technically it's straight, right?
it's technically straight.
Yeah.
You look in the mirror, hey, I don't really see anything wrong. It looks straight.
Mm-hmm.
But why do I not look like my smile? And
So I think it's so important that
yeah.
we have that conversation to sort of find out. And sometimes I feel a bit awkward during.
Yeah.
I don't know if you feel the same way during the conversations with the patients. Like, and I try to be very tactful because to me, the last thing I want is that the patient feels self-conscious about themselves and they feel bad about themselves, because I think it's important that they know what's happening, but also realize that this is okay. It's okay for you to have it, and it's okay if you like it, and it's okay if you're not bothered by it, and it's okay if you don't want to change it. So to me, there is that duality. Like, there is this thing going on, but if you're okay to not change it, then that's how we customize the plan for the patient. And I think that's so important. Rather than telling them, this is not nice, this is not nice, this is not nice, we should change everything. Yeah. So I think that is not really a patient-centered approach where we are thinking of the patient's point of view.
it's not a recipe book.
Yeah.
You cannot just find, hey, look,
Yeah.
I'm going to give you a new smile and I'm going to follow the recipe.
Yeah. So I wanted to talk about that because I think beauty is in the eye of the beholder, right?
No, you're right.
So,
So I give you one example of a beauty in the eye of the beholder. Canines, like the sharp tooth, right? Canines. And I designed
one at the
small,
corner, right?
the corner,
Yeah.
right? The one
Yeah,
over
yeah,
there,
yeah.
right? Canines. So 1 tree or 2 tree, the trees, right?
Yeah.
And some people like pointed canines,
Yeah.
but some people like blunt canines.
Yes.
And there's no correlation to whether you're a female, you
No.
like pointed canines,
Yeah.
rounded canines, whether you're male, you like sharp canines. There's no correlation to it at all. So whenever we design a smile, we put a pointed canine or we put a blunt canine. The patient's like, hey, I wanted a pointed canine instead.
Yeah, yeah,
And you're like, okay, I'll just say okay.
Yeah, of
But
course.
I get wrong all the time. And so it's so important for us to understand what they're doing and give them a sort of a prototype to try it out first before we commit,
Yeah.
before we actually make it permanent. Because once we make permanent, there's no turning back.
So you're talking about prototyping the veneers, right? Before the actual
this is
final
called a
ones.
mock-up or a smile trial that we use, and basically we put some nice material, some temporary material on top of the existing teeth.
And this is
This sort of-
without drilling.
Yes, without
Okay.
drilling. I think with Invisalign you can sort of do that with a bit of a simulation of the plan, right?
There's a digital simulation that we could do for the photos to see, if we make this a bit longer or, a bit shorter, a bit wider on the teeth, like how would it look like? So in like what we were talking about, some teeth are slightly longer, some teeth could be more worn down, then how they would look like if we did the sort of bonding or restorations after the treatment. But it's a digital one. So I think the one you're talking about is an actual model that they
it's
could
actually
see
a
in their mouth.
physical. So I know Invisalign is digital because obviously you can't.
We can't.
You can't move instantly move the teeth, right? But at least it's somewhat like a simulation.
Yeah,
of how
it's
it
an
looks like,
idea, I think.
Yeah,
of what
so I
it
think
could
that's
look
not a bad thing, and I think sometimes I show my patient a simulation as well, just so that they understand the goal that they're looking for, right?
Yeah.
Yeah.
Because sometimes also, like you were saying, they may not realize, like, when they say, oh, I want a nice smile, but the
That's very
definition
difficult.
is a bit different, right?
Yeah.
And then, so I think that mock-up that you are talking about, that sort of prototyping in the mouth, and where they can take photos from different angles, and look at how it works for them or not, and they can make that sort of slight adjustments. Maybe I want this like this, I want this like this. That is also quite nice for the patient to really customize.
I think the important bit during the consultation is actually to find out what exactly is their definition of a smile. What of a nice smile. All right?
Yeah.
And my definition and your definition is probably different as well, because everybody is different, right? And
I think
it's
like
so
you said
difficult.
also, like the canine tooth, the pointy tooth at the side, right?
Yeah.
I had a patient also tell me, oh, this, I want to leave it because it gives me my character. This is my personality, it's showing in my teeth. So she requested that I leave it slightly longer, slightly more pointy, so that we can sort of straighten the rest, but sort of make sure that part of her is still her, that her smile is still
Yeah.
her. So I think that's
no, and
as
then
you said,
another example
yeah.
is the color. Right, color is in the eyes of the beholder again. All right, and some people think that natural means really white. Some people think that
which is fair enough.
which is fair enough, or natural means yellow, and it's fair enough as well. But everybody's definition is different. So I often have to go into treating a smile, treating aesthetics is a very subjective, and often it needs a lot of time. It's not really a quick fix sometimes, and you just need to really sit down there and really understand and listen to the patient. Really listen, find out the cues, and talk to the patient about what they actually need, and reconfirm with them as well, so that we can and if we can, I think it's important for us to try things out. Try things out in the sense of putting a smile trial in, letting them have a look and seeing whether they are happy with the smile before we proceed to something permanent or irreversible. Okay, I think that's so important that in modern day now, everything is all instantaneous, right? And instant gratification. But I think we need to just step one back down, because once we change a smile and it's irreversible, it's often much more costly to change it back.
Yes,
Or
and I think
hard to
the
change.
planning is something that is so important to get right.
Yep.
Because that is the basis of everything for how we structure the rest of the treatment, right? And for Invisalign, the sort of, we can't do anything physically, but we do have a simulation where you can move the teeth a certain way, and the patients can sort of visualize it on the simulation on how their teeth could look if it's straight, if it's longer slightly here or shorter slightly here. That sort of customization could be done as well. And I think that's really helpful.
Yeah, I think that you're right. So, absolutely right. I think visual would be the best, right? Because then you can really see.
Yeah.
It's often really hard for me to paint a picture with words.
Yeah.
Rather than just showing the picture straight, right?
yeah,
And so
for
that's
sure.
so much more easier to manage. Okay, all right. I think that's all from us today. Thank you so much for joining us in our podcast, our first podcast. Looking forward to the next one. Thank you so much.
Yeah.
Bye.
Bye.